My name is Ed Lovern, and I serve as President and Chief Executive Officer of Ascension St. Agnes. Ascension St. Agnes is a strong, vibrant Catholic healthcare ministry that is changing communities, changing healthcare, and it's blessed by having an incredible medical staff, and a medical staff that has an interesting level of connectedness that really has a lot of people who've been here for years, who practice here. They could practice other places in the state, in the country, but they choose to practice here because it's a community hospital with a faith-based mission, and that's what they care about. And it shows. It shows in the way that they work together, in the way that they work with patients. It's a family. It's an organization that is serving a mission and serving as a ministry, continuing the 160 years since the Daughters of Charity started this hospital, to serve the community, to do what the community needs now, as the sisters did 160 years ago, to take care of the people who live here. We're blessed with a number of really outstanding service lines, including our orthopedic service line. Our cancer center is really renowned throughout the state and throughout the country with its leadership. We have a very successful women's care services, OBGYN. Our general surgery is phenomenal and very deep in terms of the number of general surgeons that are on the staff. We have a very strong bariatric surgery program. And our cardiology program, I think, is one of the strongest in the state. One of the things that has been very important to me in being here at Ascension St. Agnes is to make sure that administration partners with the physicians. We want our physicians to be as successful as possible in their practice, if they're an independent practitioner or if they're an employee. If they've got a dream or a vision or a thought of the way that they want to do things, we want to go to any extremes that we can to try to make that possible. And we think that's unique. We think that creates better care for our patients, and it's something different in the community than what the other healthcare providers are able to do. So our priority as an organization is to be a strong, vibrant Catholic healthcare ministry that's changing communities and it's changing healthcare. That's a simple sentence, but there's a lot packed into it. And I think being strong and vibrant means that we control our future, that we are able to do the things that are part of our mission and part of our vision, as opposed to being an organization that is not thriving and is not successful. And our Catholic identity is very important to us. The fact that we are practicing healthcare in a way that is intended to improve communities, to make communities stronger, and then to think about different ways that we are able to change healthcare. As we all know, healthcare has an opportunity to really evolve to another level. There's wonderful things about the healthcare in our country, and there's also things that are a challenge about it. We practice traditionally a lot of sick care when somebody comes to the hospital. And it's important for us to be able to do that, so when somebody's sick, that we take excellent care of them. But it's also important for us to start to think about how we keep people out of the hospital and how we have community programs and population health programs that keep people well, so they don't need hospital stays, they don't need surgery, they live as comfortably as they can in their own community. And I think that's the goal of our medical staff and what we're trying to do with a lot of the population health initiatives. So that's a priority for us. Our associates, as we call our employees, are, to me, the most important aspect of running this ministry. It's important for me with our associates that they are in a place where they are able to live their best life, where they come into work every day excited about what they're doing that day, where they feel supported, where they feel safe, where they feel like there's opportunity for them, where they feel like they're well paid, and they're excited about what they do. They're excited about our mission. They're excited about the effort that we make to take care of patients. So the opportunity at Ascension St. Agnes was unique. I'd been in healthcare leadership positions for about 25 years, and most recently in Atlanta at a not-for-profit organization. I was very excited about coming to work for a mission-based organization, Ascension St. Agnes, and to work for an Ascension organization, part of a large national Catholic system that had a common faith focus on how they take care of patients. Another thing that was really important to me was working in Maryland. Maryland's healthcare system is special because it focuses on keeping people well. It focuses on trying to reduce the total cost of care. And that creates a lot of innovation in how we approach taking care of people, and the focus on not just doing more procedures or admitting them to the hospital, but trying to figure out how to keep them well and how to keep them out of the hospital in the first place. I think there's an incredible amount of resilience among healthcare workers, and especially our healthcare workers, and they have been through a lot during the time of COVID. They're responding to a calling. They're here for serving a purpose that's greater than themselves. It's an honor to be able to work with those people, to be able to lead them and to create a place where they can do things that are responding to the call that they feel.